The Society Against Sexual Orientation Discrimination (Sasod) has lauded the National AIDS Programme Secretariat's NAP's decision to implement self-testing for the human immunodeficiency virus (HIV) that causes acquired immune deficiency syndrome (AIDS) in the hinterland regions by the third quarter of this year. Sasod had long agitated for self-testing in Guyana. During an interview with Nightly News on Wednesday, Managing Director of Sasod Guyana, Joel Simpson, stated that there is a deficit of counselor testers in the country, especially in far-flung areas. This, he opined, would have influenced NAP's decision to roll out the project in the hinterland first instead of rural areas.
Even on the coast, there is limited personnel available in terms of HIV testers and counselors who are trained and qualified under the national program to be able to do that. So given the shortage on the coast, I know the situation must be even more dire in the hinterland region. So it makes complete sense.
He noted that when the initiative commences, there must be adequate counseling and strict adherence to the 5 C's, which are consent, confidentiality, counseling, correct test results, and connections to care, treatment, and prevention services. He is also hopeful that hotlines and virtual counseling services would be implemented for persons to access.
You could provide a toll-free hotline that people can call before and or after counseling. You could provide designated centers or spots where persons can access counseling services. Given the terrain of the hinterland region, one would expect that the options would not be limited to physical spots where persons could receive counseling.
Despite mass criticism from civil society groups and HIV counselor testers that Guyanese are not equipped for such an endeavor, Simpson believes that the pros outweighs the cons, since stigma, discrimination, and lack of confidentiality usually prevents persons from not coming forward to be tested. He noted that in other parts of the world, HIV self-testing is showing positive results, expressing confidence that self-testing could curtail the spread of HIV while improving the number and coverage of persons accessing tests, especially males. According to Simpson, when compared to women, men are not testing for HIV.
Men of all sexual orientations and gender identities, because men generally don't report for health services unless they're sick. And what we know about HIV is that you don't show signs of sickness until you have an AIDS-related complication. And generally, at that stage, it is almost too late.
He encouraged members of the lesbian, gay, bisexual, transgender, and queer LGBTQ+ community, especially in the hinterland, to utilize the self-testing option. Amel Griffith for the HGP Nightly News.